practice. So weeks ago we started with the feet. We looked at the arches of the feet and how there's 3 arches of the feet: transverse, medial, and lateral. And then we focused on engaging all 3 arches versus just the more common one that we think of, which is the medial arch, the inner arch. And we looked at how the ankle is stabilized in our balancing poses. Then we went up and we looked at the knee, talked about the anatomy of the knee and how we can use the knee to help reset the hip by pressing it in and pressing it out at the same time. That helps to set the proprioceptors in the hip in a lot of standing postures. And we talked about how the knee has some rotation once it has a certain degree of flexion. We talked about the hip. Following week, ball and socket joint, wide range of motion, looked at the pelvic girdle, how it relates to the sacrum, the SI joint, letting the knee come forward a little bit as we go through our prayer twist to not torque the SI joint, about the piriformis and how that can put tension on the sciatic nerve, and some of the postures that we can do to help alleviate that. So that brings us up to the spine, right? So the spine is broken up into a series of sections. Your spine, you have a cervical spine, a thoracic spine, a lumbar spine, and then there's a sacrum and a coccyx. Okay, the cervical spine has 7 vertebrae. The thoracic spine has 12, the lumbar spine has 5, and the sacrum is 5 fused vertebrae, which don't fuse until early adolescence. As we start to get up we start down on our backs or our bellies, right? And then slowly we work our way up to our feet. And so these 5 vertebrae start to fuse together, provide more stability as we get up to walking around, jumping, running, doing all those things. And then the coccyx, 4 to 5 fused vertebrae as well. A way to remember this, if you ever so wanted to, is, as I tell the YTTs, breakfast, lunch, and dinner, right? You have breakfast at 7, you have lunch at noon, you have dinner at 5. So 7, 12, 5, all together, 24. Your spine works for you 24 hours a day. Okay, now the anatomy of these sections of the spine are quite different. If you look at the lumbar, the vertebral body of the individual, one individual lumbar section here, it's much thicker than the cervical body. Okay, you have the vertebral body, and then you have the spinous processes, which stick out either straight back or off to the sides. And then on the side is the facets, which create this interlocking, kind of like Lincoln logs, between each one, which provides some stability, and it also limits the range of movement. These are more gliding joints, but when we twist, they will hit one another, and so that twist has to work its way up the spine, right? As you start to twist, facets hit facet, and then it goes to the next one, next one, next one, next one, next one, next one, works its way all the way up. The spine itself has a term that's called tensegrity, meaning that if the spine were on its own here without anything else attached to it, if I were to pull it and then let it go, it would pull back towards its neutral position. The amount of ligaments and tendons and connective tissues that wrap around the spine help hold a certain level of stability, right? Maintain a certain level of stability. Now, the spine serves a number of functions. One of its primary functions would be to protect the spinal cord, which is shown here in yellow. The spinal cord passes down through the vertebrae of the spine, and then the peripheral nerves radiate out to all of the different muscles, organs, and systems in our body. All right, so relating this to the yoga asana practice. We talked about how when we go into our prayer twist, we want to let the knee move, right? We let whatever side we're twisting to, if we're twisting to the right, that left knee wants to come out in front. That lets the hips move, that lets the spine move. That lets the SI joint stay neutral so it doesn't get torqued. So that's one thing, down at the very bottom of the pelvis. We also want to engage the core to help support the low back. The lumbar spine, see the spacing here versus here, you can't even see it, well, 1, because of the shoulder blade, but 2, you see how close these are together? The lumbar spine is much more built, it's much more naturally built for a back bend because there's more space there. The thoracic spine for forward folding. The cervical spine kind of sits in between the two. So when we go into a back bend, we can collapse into our low back. A lot of back pain happens at L4, L5, which are these bottom 2 here, right above the sacrum. And because there's a lack, one reason could be a lack of core stability. When you hear teachers cue, pull the belly in, pull the belly in, pull the belly in, it's to try and engage the deep muscles of the core. It's 4 layers. You have your rectus, internal, external obliques, and the transverse abdominals. That deepest muscle wraps around like a corset, goes all the way around here to the back. There's also, you hear a term Valsalva maneuver, this drawing the navel up and in, helps to engage the deep layers of the core and provide some stability to the back. At the same time, there's the pelvic floor and the diaphragm, which sits in here. It creates like a sphere. When we pull the belly in, engage the pelvic floor, and breathe in, which the diaphragm then contracts, this becomes a very strong bandha, a very strong lock. We want to try and use that lock often, especially with back bending postures. So something like Ustrasana, camel pose, we got to really pull the belly in, stabilize and lengthen these vertebrae so that as we arch back, we don't collapse down and compress them. So we know the lumbar is going to give us the most room into extension of the spine. The thoracic is going to give us the most room in terms of flexion of the spine. So it's really important that we practice core stability and strength to help protect our low back. When it comes up to the cervical spine here, up to the head, there's a number of cues, sometimes head rolling, right? We hear this thing. And if you do this, and we're quiet enough, you might even hear your neck making some noise. Right? There's, because of the position of the vertebrae and the processes, there's a rubbing of bone to bone that can happen when we do those big neck circles. It's not advised to really use that as a warm-up technique. Anatomically, it would be better for you to move on one plane. So if you go this way, and then you go down and up. If you read The Anatomy of Hatha Yoga by Coulter, he gives an example of if you're sitting in a room and there's a loud banging noise off over your right shoulder, right? You hear this, all of a sudden there's this really loud bang. You wouldn't go like this. So look at it, right? That's not the way your body's built. You would turn your head like that. That's the way it's meant to move. So one thing, it's a common cue, this neck rolling. Best to go side, side, top, bottom, and then we can move this way, right? Yes, no, maybes. Yes, no, maybe. Right? We could do those instead. So cervical spine, protecting the cervical spine. The other thing with that, cranking the head back. There's a lot of cranking the head back. Upward facing dog, we crank the head back. You see it in yoga pictures, right? People cranking their head back. Ustrasana, cranking the head back. All these different back bends where the head goes back. By dropping the head back like that, we don't have any more of our anatomy coming up through the skull here, but in terms of blood and veins and arteries, going up into the back of the head is something called the basilar artery. The basilar artery provides oxygen and blood to your ocular system and other parts of your brain. When you crank your head back like that, you can impinge, you can clamp. It's like clamping the hose. You could clamp off the flow of blood and oxygen to your brain. Worst case scenario, stroke. Very rare. But even before that, lightheadedness, dizzy, issues with your eyesight. So we don't want to crank the head back. Okay? The last one, and then we'll get going, is this folding and rounding up through the spine. That's another common cue. We come down, right, and then we go up one vertebrae at a time. Now this can be fine, and for a lot of us, I'm sure we've done this before, I've done it before, and it was fine. However, if you were to have any type of misalignment through the hips and through the low back, if you already had some type of deviation that was creating an issue in your spine, rolling up could exaggerate it. If you had a slip disc, or you had a bulge disc, or you had, well, if you had a hemorrhage disc, you'd know it. But if you had a slipped or bulge disc that was slight, you could force the pressure to increase on one side depending on that bulge and make it worse, create pain. So what's called the high hinge is where the thoracic and lumbar spine meet, right about here. And this is the low hinge, is down at the hips. When we go forward, we want to hinge from the low hinge. When we come back up, we want to come from the low hinge, not the high hinge. Just think about trying to keep your spine as neutral as possible until we go into a conscious back bend, forward fold, or twist. But a lot of standing postures, you should be trying to keep it neutral. So when we come into a forward fold, we come down from the hips, hinging at the hips, hinging at the hips, hinging at the hips. This is where the most amount of torque is going to be on our back because the most amount of weight is away from center of gravity. As we come back in, then we can start to round with a little more ease and a little bit less stress and strain on our back. The same is true as we come back up. So as we come back up, we put a little bend in the knee, especially if the hamstrings are tight. We can tilt the hips forward, neutralize the spine, and then we rise up with a neutral spine. Every time. right? Every time in a forward fold, every time on the way back up. All right. Now that's the short of it. Imagine that. Imagine what the long of it looks like.